Hey all, welcome to Science on a Saturday. So today's going to be a little bit different, and the purpose of talking about this is several-fold. Number one, part of this channel and part of this health journey that we're embracing and embarking on together is to encourage you to sort of question everything, to question, some of the things that we hear about, how science can be manipulated, how culture can influence scientists, how industry can influence scientists. For example, if you look at the trajectory of sugar over the past, 50 years, right? Sugar was bad, then it was good, then now it's bad again. If we look at fat, the same thing. So, what we're seeing here is some really interesting responses from our society and how society is influencing doctors and how doctors are actually sort of scared to share scientific facts based upon what the public perception is. And so that's why we're talking about this. This is not going to be a sort of cultural channel. I want to encourage you to sort of use critical thinking. This is what we were supposed to be learning in schools. Now, I came across this article. Let me share with you the actual article this is from the New England Journal of Medicine. So for those of you that are somewhat new to medical research or health research, New England Journal of Medicine, Archives of Internal Medicine, these are considered kind of like the sine qua non, like and the Lancet are highly reputable journals. And so the title of this is Open Schools, COVID-19 and Child and Teacher Morbidity in Sweden. Now, before we even go any further, why is this important? Because kids are suffering disproportionately from our society's responses, taking kids out of school, removing kids from sports, causing kids to be forced onto screens and be sedentary, to excessive hand washing, masking, distancing. All of these things are not side effect free. There are unintended harms associated with how we are treating our children. So it's important that we evaluate the risk benefit. Risk analysis we make risk analysis decisions all of the time. The reason why you wear your seatbelt in your car and you follow the speed limit is to not kill yourself, right? There are side effects associated with certain decisions. And if we were to reduce the speed limit on freeways to 5 miles an hour, we would probably prevent a lot of deaths related to automobile accidents, but the food that you depend upon and eat and those packages that you order from Amazon and everything else, they would be, the food would be rotting on the shelves. There would be widespread hunger, right? So anyway, when we're closing the schools, we are causing challenges to children from their developmental issues, from all of this. So when a scientist looks at one of the only countries in the world that kept their schools open and found that, there wasn't much of a negative impact to children and teachers, that should be good news because our children are being, again, disproportionately affected by our societal's response to the virus, and closing schools has a litany of side effects that could lead to loss of quality adjusted life years in those children for years to come. Can shorten lifespan and all that. Anyway, but that wasn't the response that this professor, Jonas Ludvigsson, got over in Sweden. He got canceled. And so this professor, poor guy, he quit scientific study in COVID-19. He was studying a lot of various aspects of COVID-19. I don't know his whole, CV and all of the research interests that he has, but he got canceled. So that's absolutely bananas. Now, here's why he got canceled, because he went against the mainstream narrative. Now, here's a brief appraisal of his findings. Now, what he did was he looked at intensive care unit hospitalizations and to quantify that pre and post COVID. He also compared deaths in children under the age of 16 pre and post COVID. Here's what's interesting. In children in the pool of children under the age of 16 in Sweden is 1.9 million kids. So 1.9 million kids in the 4 months prior to the pandemic. Okay. 65 children under the age of 16 died. Now, in the months following the pandemic, between March and June, remember, Sweden did not close their schools. They encouraged distancing, but they didn't require facial coverings. Guess how many children died? Again, during the same 4-month period when the pandemic started versus before. 69. Okay, so 4 more children, which is not statistically significant, out of a pool of 1.9 million children died, and schools were kept open. Now, again, because there's a long list of side effects associated with keeping kids out of school, of preventing kids from, interacting with other children, of distancing kids, of forcing kids to be sitting and staring at screens all day, those have lasting side effects and consequences from developmental issues, from mood, affect, behavior, obesity, everything, right? These are challenges, depression, all of that. We should be like looking at this and going, wow, okay, only 4 more children out of a pool of 1.9 million available children died because potentially of COVID-19. Now, this is where it gets really interesting when it comes to COVID-19 related intensive care unit hospital visits. Again, when in a country that kept pretty much everything open, including the schools. Now you can say Sweden's a small country, but again, 15 children out of 1.95 million children, only 15 made it all the way to the intensive care unit from COVID-19. Okay, as a parent, this should be good news. This should be like, oh my gosh, okay, we got to rethink this. Okay, I know we were all scared early on last March. We didn't know what was going to happen to the kids, all that. Okay, but in a country that kept their schools open, we should be like 2 thumbs up. Let's rethink this. Let's move and look forward and everything like that. But no, that's not what happened. This doctor received death threats. You can't even find him on Twitter. He deleted his own Twitter account, I believe, or made it unpublic because so many people were going after him for purportedly spreading misinformation. He's sharing hospitalization records. And so I don't know where we go from here, but I really encourage you to question where you get your information, because clearly there is a media bias and people are aligning with and they're buying into irrational fear. Now, this is not the first time such sort of situation where the public and even colleagues have gone after physicians. There's look at the history of hand washing and the Semmelweis. Inge Semmelweis, he was a Hungarian physician who encouraged his colleagues to wash their hands after leaving. After doing other interventions before helping mothers deliver babies. Now, he was ostracized by his profession for sharing information that other people didn't like. Other physicians didn't like the idea that they were forced to wash their hands before delivering a freaking baby, right? So history tends to repeat itself. And I'm sharing this information with you, again, not to trash CNN, not to trash NPR, but to get you to realize that a lot of people our thinking is becoming skewed due to seemingly irrational fear, and because our containment strategies have side effects and consequences, lasting consequences for children. So I just want you to think through this. So these are some things that I'll be sharing with you all. Some of these articles in the show notes. If you're listening in iTunes, thank you for that. If you're here right now listening on YouTube, I'm grateful for you for being here on a Saturday. Thank you for that. Of course, I hope you're actually listening to this as you're hiking or playing soccer with your kids or something like that. I want you to be outside, hanging out with your kids. Now, let's talk about the teachers, because this is actually a preprint journal that was just published. And for those of you just listening, the title of this, because there's this perception amongst the media and so forth that they say that if teachers go back to work, they're all going to die. And if every teacher is dead, then who's going to teach our kids? Well, actually, a bunch of scientists in the UK actually wanted to see, do teachers, are they at increased risk of dying and having severe illness? And actually, this is not what they found compared to age-matched people who are working in the environment right now, at grocery stores, at drug stores, at restaurants, and at hospitals. So the title of this study is Risk of Hospitalization with COVID-19 Amongst Teachers Compared to Healthcare Workers and Other Working Aged Adults in a Nationwide Case Control Study. Now, full disclosure and just a little disclaimer, this is not peer reviewed. This is a preprint, so it hopefully will be accepted in a journal. But in the next study that we're going to talk about, well, we don't know. It may or may not, because science has become political, unfortunately. So the conclusion here is, compared to working age adults who are otherwise similar in age and risk factors and so forth, teachers and their household members are not at increased risk of hospitalization with COVID-19 and are at a lower risk of severe COVID-19. Hold on. Wait. I thought teachers are around these kids and it's a germ factory and they're all going to die. And if teachers go back to work, then they're going to die. But let's read that again. Okay. Compared to working age adults who are at otherwise similar age and so forth, teachers and their household members are not at increased risk of hospitalization with COVID-19 and are at a lower risk of severe COVID-19. These findings are broadly reassuring for adults engaging in face-to-face teaching. Okay, well, not that I was necessarily concerned for teachers. My daughter, she's only in the 3rd grade. But all of our teachers have been under the age of 30, okay? And we know, and up to now, at least for her, all of her teachers have been females. Growing up, I would say 80 to 90% of my teachers were females. There's significantly a higher proportion of female teachers compared to male teachers. We know that females, from a statistical probability standpoint, are less likely to have severe COVID-19 complications and death and all of that compared to males, and they're significantly younger. And so what's interesting, and I have a whole nother video coming about this, is this myth that's been propagated, that this idea that we have no pre-existing immunity for this virus. Now, that's actually not scientifically true, because there's a lot of homologous and shared structural features with otherwise benign common cold-causing coronaviruses that we're all exposed to in this particular, SARS-CoV-2. And so about 50% of individuals who have not been exposed to the novel human coronavirus have pre-existing immunological memory to the novel human coronavirus because of prior infections related to structurally similar and more benign coronaviruses. So the media has made this I think false narrative that everyone is very disproportionately equally likely to get very sick from this because we have no immunity. But there is some cross-reactive immunity from individuals who have been exposed to more benign coronaviruses that circulate, especially amongst schools. So there could be the theory that actually teachers might have more pre-existing immunity because of the fact that they're more exposed to kids who have benign common colds caused by coronaviruses, and as a result, they have more T-cell memory due to many of the shared so-called homologous features. So a homologous protein is a protein that's not identical, but similar. And so that data is out there, and if you want, I will link that in the show notes. It's something we should all be aware of. So I do just want to just check into the feed, make sure we have sound and we're good and all of this sort of stuff, and everything like that. So how are we doing on a Saturday, friends? Okay, I see you here, which is great. Let's get into another study. And this is another a director. His name is Carl Hennigan. He's a director of evidence-based medicine over at Oxford University. So we're going to get to that. But first, I do want to let you all know that this show and many of our podcasts are brought to you by our very own Myoscience Nutrition. So I created a product line because I was working with clients, and I still do. I do one-on-one coaching with folks to help them with weight loss and fasting and hair loss, just a lot of different things. And I wanted to be able to offer high-quality formulas that I could stand behind, that I knew what was on the label was actually in the bottle. And so that's what we're doing here at Myoscience. And a lot of you are into fasting, you're into low-carb, ketogenic style diets. One of the things that we've had a lot of success with when it comes to helping to replenish electrolytes and foster deep restorative sleep is our Myo Relax and Calm. It's been a very powerful and effective formula. And also berberine hydrochloride. Berberine to kickstart your fast can be absolutely phenomenal. It's one of the things that I recommend to people all the time because it helps suppress appetite a little bit. Once you start to take it, you don't feel that need to actually, break your fast and have some snacks and nibble and all that, because berberine is an effective way to actually increase your ketones. So I would encourage you to check out some of the amazing solutions that we have over on our website at myoscience.com. That's Myoscience with an X, MYOXCIENCE.com. You can use the coupon code podcast to save. So let's get into this. This is this gentleman here. His name is Carl Hennigan, and he was actually the author of the landmark Danish masking study. Now, a lot of you have heard about this. Maybe some of you haven't, because the media doesn't like to talk about this. And check it out. Scientists who are writing pro-mask articles, reviewing some of the observational data and literally laboratory data where they put masks on people and spray stuff in the lab, right? Totally different from what you're doing when you go to the grocery store and people are putting their face mask in their pocket and it falls on the floor, and then they touch their keys and their cell phone and they put it below their neck at the restaurant and then they pull it up and go to the bathroom. Okay, totally different from how healthcare workers wear face coverings, by the way. But with that being said, this gentleman, his name is Carl. He's the director of Oxford's evidence-based medicine program. So this guy is not like, some right-wing QAnon, scientist or anything like that. This guy is a high-level researcher being paid to research evidence-based therapies, okay? Twitter is censoring this guy, and they fact-checked his study. Okay, so if you don't know the Danish face mask study, okay, essentially in Denmark, they did not have, there's a few different countries in a few different pockets of Europe that didn't mandate facial coverings. And, so scientists thought, what a great way to actually randomize and do it, because up to now, there hasn't been any randomized human studies to vet facial coverings. It's been all observational studies looking at, hey, this county mandates them, this county doesn't, so let's look at the rate of hospitalization and infectivity. So this author said, hey, look, since these pockets don't mandate them, let's randomize people and say, don't wear your facial covering in public. And then it was about, I think 1,500 people in each arm. It might have been 3,000 in each arm. I can't remember. It's been a little while since I've read the study. Anyway, 50% of the people didn't wear a facial covering for a month, and 50% of the people did. The rate of positive cases between the two groups, 53 people in the non-masking group versus 49 people in the masking group out of a pool of several thousand. So it wasn't statistically significant. Now, the shortcomings of the study was that they couldn't see, okay, so only the difference in infectivity wasn't significant, but the media says, well, that study wasn't powered to look at how many other additional people got infected, versus how many infections were prevented in the masking group. And I understand, I get it. That study was not, powered and designed to affect that. But the difference in positive cases was four over the course of a month, in thousands of people wearing masks versus not. And so this guy, he's been getting censored online for he's not an anti-masker. He's an evidence-based medicine and evidence-based scientist. And so he offered this little interview. So I'm going to play this clip. Again, his name is Carl Hennigan. You can follow him on Twitter. Again, this is one of these people that the woke mob, they're censoring. They're saying that you want people to die. It's become this sort of situation where if you question anything, and again, the purpose of this channel, the purpose of this podcast is to question everything. We should be questioning, why does keto work? Why does fasting work? Why should you not eat sugar? Why should you be going to bed? All of these things. We need to question everything. And so here's Carl. He's questioning, and he offers a great way to think through this. So this was a recent interview that he gave. So let's cut to this. I think you all are going to dig this.
So what happens in these situations is of uncertainty, the opinion divides. I think masks are a good idea. I don't think the I shouldn't wear them. And that's where we end up with people proposing more and more. They're saying put them on in schools, put them on in pubs, put them on in shops. But there's no clear evidence. They use observational data to inform their decision. Now, if you look at what's happened in the UK, for instance, we put masks in on 24th of July. They were supposed to reduce the risk of infection by 40% within the next 2 weeks. In fact, infections detected have gone up. So, in effect, people are not looking at the evidence. Now, when Norway looked at this, they looked at it and said at low circulation, the public health consequences are so minimal that actually it's not clear they work. And even if they did work, we reckon about 200,000 people would have to wear a mask fully for a week to prevent one infection. Now, That's how you have to think about the uncertainty. If you're going to put a policy in place, that's fine. What you can't do is say it's evidence-based, because when people talk about the evidence, they have again cherry-picked low-quality observational evidence to suit the argument. But they haven't picked then further observational. So, for instance, if you put masks in, what are you expecting to happen to the case definitions and the reductions in the next 2 to 4 weeks to show it was a worthwhile policy to enact?
All right. So hopefully you found that at least somewhat interesting. I don't know what sort of presentation that was from, but I just wanted to share that with you because, again, like I feel like there's this thing called confirmation bias. We're all familiar with confirmation bias, but I feel like there's a lot of confirmation bias going on right now. And what's interesting is, some of these articles get shared more if you kind of go along with the mainstream narrative as opposed to not. And so I just think it's all good. It's good for us to sort of question all of these different things. Again, I don't want you to deny science, but we need to realize that we should be evaluating these things, especially when there's a potential to harm. And the harm, I think, with facial coverings, arguably, is the environment. The environment is getting really negatively affected from all of these face masks. I mean, I don't know about you, but I see these things on the ground all the time in public. They're filling up landfills. They're creating a lot of problems in the ocean. These things are getting stuck in ducks and fish. I mean, they're on coral reefs. I mean, all of that, right? And what if they're making things worse, right? What if this thing could have been? I mean, what if they're contaminating more people? All of that. We just kind of assume that it's all positive. So that's where we're at today. But anyway, let's talk about something. So Jeffrey says this guy's talking about not wearing a mask. He got COVID himself. Yeah. And it was a cold for 2 days. So who really cares? Now I have antibodies. Now I'm not going to go get anyone else sick. So Jeffrey's trying to criticize me for saying COVID. You know how many people have gotten COVID by doing everything right and wearing masks? There's a lot of them. In fact, according to the CDC, people self-report that new infections is about 85% of new infections say they always wore a mask when they left their house. So I got COVID and I'm done. I got antibodies. You're probably going to get COVID too. So I'm not worried about it. There was a question on, what about long haulers and how do you sort of reconcile that? Look, I mean, obviously this virus does create this hyperinflammatory syndrome. And so if people are predisposed to inflammation, they already have pre-existing autoimmune issues or chronic inflammation, then sure, I think there's going to be challenges associated with that. And that's really unfortunate. But again, what's the long hauling effect of being unemployed, right? As a result of all of these things, as a result of taking kids out of school, of canceling sports. So it is unfortunate that some people are going to experience lasting effects, and they are a small percentage of the population. But that doesn't mean that we need to keep everyone locked in their home or shut down businesses or close gyms or close schools forever, because that's going to create long haul issues associated with the complications and side effects linked with that. So, yeah, I mean, I think it's real. The fear over long haul, chronic issues means that we need to double down on healthy lifestyle change, that we should be encouraging exercise. We should be encouraging regular physical activity. We should be telling people to go to the gym. We should be, encouraging people don't eat fast food and things like that. So what else do we have here? Folks in Asia just wear masks and don't whine like Mike. Yeah, I mean, if people want to wear masks, that's fine, but you shouldn't mandate everyone wear masks, and you shouldn't mandate kids wear masks playing soccer or in school. I mean, all the time. People can do whatever they want to do. There's in other countries, they make women cover their faces. Does that mean that we should make women cover their faces in all over the world? No, we shouldn't be doing what other people do just because it's normalized in another country. In other countries, they kill young girls, right? Should we kill all young girls too? No, obviously we shouldn't do stupid things like that. We can't normalize what other countries do just because other countries do it. There's different cultural norms. Let's see here. What else we got? He's immature about masks, but he's 100% right about metabolic health. Yeah, I mean, again, show me a randomized study that show that face masks are effective. I'm just looking at the data, guys. That's it. Look, now let me just give you a little story about masking, okay? Last February, I went and got a hernia procedure. I flew to Canada. You bet your butt I wore a face mask on the airplane, okay? In a closed environment for a virus, and I couldn't afford to get sick prior to a surgery, especially in another country, right? So I'm not saying in every situation face masks are totally stupid. I'm not saying that. What I'm saying is just think about it for the common sense thing. When was the last time you washed your facial covering? Come on. When was the last time you washed it? When was the last time you actually took care of it? How often has it been in your pocket? How often has it fallen on the floor and then you put it back on your face? How often has it been in proximity to your keys, to your cell phone? Right? So the thing is, we're looking at this as though there's no unintended and unthought of consequences to these facial coverings. Obviously, they have a value in confined, close, crowded environments. But that being said, most people are not probably wearing them right. They're dirty. Like I infected my eye touching this thing. So I'm not saying in all situations they suck. I'm just saying when you're telling 333 million, put a used sock over your face or take your dish towel and wrap it, there's no prescriptive guidelines or quantitative, the perception is there's no quantitative differences in material and all that. Just cover your face no matter what. I just don't think that's a really good policy. That's just my thing. So anyway, what other questions do we all have? Are you guys sick of talking about this stuff? Where did I get my surgery in Canada? It was at Shouldice Hospital. So I have a whole video coming on this, but Shouldice they specialize in hernia related procedures. And I had an inguinal hernia that I got. It's a crazy long story. I got it actually deadlifting when I was fasting for a 5-day fast, and I was a little constipated, And I went and worked out. We're at KetoCon in Austin, Texas. And I woke up in the morning, I saw this little bump in the lower abdomen, and I turned to my wife, Deanna, and I said, I think I got a hernia. And she looked at it and she pressed it in. She's like, yeah, it does. And I was naive thinking that it would go away on its own, which it of course didn't. So I ended up going to Canada to get surgery. So, yeah, that's how I got it. But yeah, I mean, especially last February, we didn't know about what this virus, how bad it was going to be or nothing. But now that we know, and now that I've had it, and look, and by the way, the people that are criticizing me, I wore my mask in every public place, right? You can't go anywhere in Washington in any business and not wear a mask. And so, yeah, and I still got the virus. Okay, so there's that for you. What else? I see masks laying around everywhere, parking lots. It's sickening. Everyone is so concerned about masks, but not the environment. I agree with you, Steel Tongue 502. It's really, really sad. So, I'm with you. I'm not, we got to think about the unintended harm. So, Josie said, don't touch your eyes with your dirty, filthy hand. My dirty, filthy hand. No, my hand was touching my mask and then I touched my eye. So it's not my dirty, filthy hand. I was touching my mask and I touched my eye. In fact, I infected my eye in making a satirical video, kind of imitating Dr. Fauci. That's how I got my mask. That's how I got my eye infected. Okay. Why do doctors wear masks during surgery? That's interesting. They wear masks during surgery. Okay. Let's just think about this. Okay. When doctors gown in and scrub in, that's totally different than you pulling your facial covering up when you get up from a restaurant, going to the bathroom, and then pulling it down and touching your face. Okay, we're comparing an apple to a grape. Okay, you're not comparing apples to apples here. In fact, if you look at the data on healthcare workers in surgical infections, Sean Baker has talked about this a lot, that the masking doesn't actually prevent infections in surgical settings either. But why do you think that physicians wear that? Because you have an open wound, right? You have someone getting surgery, and you want to reduce the probability of that person getting infected by the physician. So that's why surgeons wear the facial coverings. Pretty simple. Jeffrey says all it takes is one person to infect many, or not. I mean, if one person gets infected, we can talk about that. There's been many situations where, for example, I got sick, my daughter and my wife didn't. We live in the same household. I didn't know that I was infected, and I was around my employees. Guess what? They didn't get sick, right? This idea that one person infects 10 others, then I don't know. I mean, there's a lot of people that in the same household where one person got sick and then others don't. So it's kind of interesting. I have a friend, Lynch's, where one kid got sick, the other two didn't. One parent got sick, but the other parent didn't. So it's a family, of 5. So it's kind of interesting, James, I do want to check out the book, The Contagion Myth. That sounds interesting. Vic says, hang in there with all these offensive comments coming at you. You're doing good. Thanks, man. Yeah, it's crazy. I mean, it's crazy. So, friends, as always, I'm grateful that you were here. Hopefully you found this sort of interesting. Again, this is the article that we're talking about, this Jonas Ludvigsson, and I think you should share this with friends or family if you found this helpful. So as always, thanks for being here on a Saturday. If there's any other questions besides comments that I'm a bad person or something like that, let me know, and we'll catch up with you all soon. Have an awesome day. Thanks for that like button. Thanks for tuning in. See you later. Bye, guys.